when I was training to be a GP, I had an amazing 6-month experience doing obstetrics and gynecology with some really excellent teachers. And I think that really sort of helps when you've got those sort of teachers and support that really involves you in that speciality. That was followed up 2 years later when, again, almost by chance, I got placed in a job with the speciality of genitourinary medicine. So that was very much focused on sexual and reproductive health. And again, the peers and the specialists I were involved with were extremely supportive and very encouraging. And due to that, I sort of really started to find my feet in that speciality and just really develop my skills with patients of being sort of open and approachable. And I think that because patients find that I find it very easy to talk about, that hopefully that reflects on them and they find it quite easy to then be open with sometimes difficult conversations.
I've been working in sexual and reproductive health, or women's health we used to call it, or family planning for a long time, more than 30 years. So when I first worked in the area, there was only a surgical option, and I guess as a doctor, as a woman, as a daughter, a mother, a sister, I understood what unplanned pregnancy and what choice was about, so I was always pro-choice, and I always was an advocate and a supporter of women in accessing surgical pathways to have abortion. I didn't feel that I wanted to be a surgical provider, but I suppose, as I say, by the time medical was available, it became clearer and clearer to me that this is something that I could do, I should do, and that I was comfortable to do. I then really started providing in the context of my current work where, I was asked by the organisation I work for to look at protocols around medical abortion, to look at access for Aboriginal women to abortion more generally. And so in developing those protocols, I did the training and became a provider. And then I suppose, the next step along is, providing some support and encouragement to others to provide.
When mifepristone first became available in Australia back in 2010, I was overjoyed. It was long past time, and it had taken a lot of energy and struggle on many people's parts to achieve that. So I became a prescriber as soon as I possibly could. It was a few years, though, before it became readily available in general practice and was available on Medicare. But I took it as my responsibility as a doctor working in women's health, sexual reproductive health, an area I've worked in for 30 years or longer, because it sits so well in general practice. As general practitioners, we care for women throughout their lifespan in all other areas of their need. We help them fall pregnant. We give preconception advice. We do antenatal care. We do menopausal care. We help them with their periods. So why, when they have an unplanned pregnancy at one of the lowest times in their lives, we can't be there to help them and support them was always beyond me. And I still think that sexual and reproductive health must include unplanned pregnancy and abortion, so that at that time the woman's not referred off to a stranger or to a far distant regional centre. She can be supported by a doctor she knows in her own community. And that was my reason for becoming a provider.
I've always been a very strong believer in personal autonomy, that it is your life and your body, for you to make your choices. And I think because of that belief, I'm very keen on empowering people, men and women, to make their own choices. And of course, in this aspect, it's their reproductive choices of having family and children when they want to. So it should never be by chance. There should always be people having children by choice. And I think those sort of feelings within me really sort of encourage me to carry on and make me very happy and proud of the work that I do. Patients often leave our clinic strangely with what they describe as a positive experience, and if a very difficult life decision can turn into a positive experience, then as far as I'm concerned, I've done my job well.